Thanks for watching. I'm Andrew Sherberg with Stages Elder Care Law, and today, backed by very popular demand, I have Lauren Trondal with Senior Benefits Simplified to talk about all things Medicare plans. It's open enrollment time when we're recording this, and we did the same interview last year, and people really responded, and we thought it would be a great idea to do this again because plans change every year. So Lauren is a licensed insurance agent, and among the many things that she can do is help people with their Medicare plans. And it is, of course, there's multiple times when you may get onto a Medicare plan. The big thing right now is open enrollment, but also there's, when you age into the plans, and also we're going to talk about the birthday rule and all kinds of things today. So, and I should mention, she's also an attorney and has her MBA. So she's a really great resource for the people that work with her. So tell me a little bit about Senior Benefits Simplified and what you do, and then we're going to jump right into kind of an overview of Medicare.
Yeah. So when I meet with a client, which is what I do every day, it's a full picture analysis, just probably like you do, right? You're not sending a questionnaire asking their date of birth, right? You
Yes.
are looking at the big picture. So we're not just looking at what currently their health looks like today. We're looking at what long term conditions they're worried about, what their healthcare needs may or may not be currently and then in the future. And then we kind of gauge their preferences and their best interests at that meeting, and then help navigate to the proper insurance plan
That's
or
great.
plans.
And that's one of the reasons that we really appreciate working with you is you take that holistic view and that, it's not the immediate, what's going on now, but it's that long picture of
Mm-hmm.
if we do this now, what is that going to mean down the road?
Mm-hmm.
That's great.
Mm-hmm.
So, and what you do, you work with people on a very individualized level,
Mm-hmm.
right?
Yes. So Medicare is really the first time in your life where you get an individual opportunity to enroll in insurance, right? So for most people, they're on a family health plan, right? I'm covering myself and my spouse and my children. But when you get into Medicare, it's the opportunity for individuals to go separate and to look at it individually and what their personal needs are, and then go with the best plan that works for them on their needs. And then looking at their spouse, they may go an entirely different direction because their needs are completely different. So, yes.
So, I think a great place to start is when does that decision, right? So there's my understanding is there's different times when we might go on to Medicare. So, and you're going to explain it way better than I'm going to
Yeah,
stumble through it.
no, it's great. So there's a couple of times in your life when you, as we call it, qualify for Medicare. For majority of individuals, it's when you turn 65. You now qualify for Medicare. It doesn't mean that you need to go on Medicare, right? If you're still employed with someone who's over 20 employees, or it's considered credible insurance, which means it's either equal to or better than what Medicare offers. You don't necessarily have to go on to Medicare, but you're eligible for it. If you've been disabled for more than 2 years and are receiving Social Security disability income, they'll automatically put you on to Medicare after a 2 year window with that. Or if you have end stage renal failure or ALS, that automatically jumps you into the pool for Medicare. Those are really the only areas that get you onto Medicare. People always ask me, oh, it's Medicaid. No, it's completely different, as I'm sure you're now aware, right?
We hear this all the time and
Yeah.
have to explain, in the context of a lot of what we talk about, it's who covers long-term care and the difference between those two things, and we can talk about that later. But
Yes.
yes, many people get confused about
Mhm.
what's what and when they're eligible, and then once they are,
Yes.
like you mentioned, now it's our first time for many people in their lifetime where they're picking basically a plan individually,
Yes.
and there's a million choices. That's an exaggeration, but there's a lot of choices out there.
There are. There
Um,
are.
is it fair to say that those choices kind of fall into two big buckets?
Yes, there's two big buckets. So there's original Medicare, which is A and B. So you'll hear people say, I have A and B. That is what we call original Medicare. Within that encompasses your hospitalization and your day to day living, but there's deductibles and there's coinsurance or out of pocket risk that you face if you only have A and B, right? So that's important to make note. Then you have two options and two options only. There's a lot of confusion because there's a million insurance companies that are in both options. But if you can understand how they both work, that's probably the most important piece. Um, on the one side, you have a private insurance product which is a supplement with a prescription drug plan, because you have to have a drug plan or the federal government will tack on a penalty for life. They love those lifetime penalties. All right. But the supplement and the drug plan, that's the first side. The other side of the equation is what you see all over your TVs right now, especially, which is not me, right? It's insurance companies, but those are called Medicare Advantage plans. And those include benefits for your medical needs along with prescription drugs. So those are two different scenarios. They each operate completely different. It's very important to understand both sides, but I won't take up the time today to go into that.
Sure. So when you have the Advantage plan, you have an Advantage plan, and it's sort of the umbrella. When you
Mm-hmm.
have a supplement and a prescription, you have traditional sort of A and B,
Mm-hmm.
and then you have the supplemental and then the prescription.
Correct.
So it's kind of three different
Yes.
plans.
I always
Yeah.
say if you have a supplement with a drug plan, you think about it, you're paying three premiums a month. You're paying for your Part B, usually. You're paying for your supplement, and then you're paying for your drug plan. Whereas on the other side of the equation, we always have to have A and B. The federal government mandates that one. That's another penalty piece. But then you may not pay much, or if anything, for your Advantage plan. So,
Gotcha.
yeah.
So we make this decision and we're on a plan for a year or maybe less, depending on when we become eligible.
Mm-hmm.
But every year, the open enrollment season is roughly the same period of time.
Mm-hmm.
And tell me about how that part works.
Yes. So the open enrollment or annual election period is the term they say we're supposed to say, but open
Yeah.
enrollment to the world is October 15th through December 7th. And this happens every year. Beginning on October 1st, that's when really you'll start seeing some ramp up of the TV commercials. You'll start see people really hitting you hard. Your phone will start ringing if you're in the system. And then someone named Steve will answer. So, that's what happens at that time. And that is your opportunity to change your prescription drug plan or your Medicare Advantage plan, or toggle between the two at that time.
And that was going to be my next question is, can you
Yes.
switch back and forth?
Sometimes there's caveats to that, but I
Yeah.
just, for blanket, that's when you would toggle between the two if you're able to. The supplement is a private insurance product. So as long as you're paying that premium, it's going to continue on. Now, those plans have their own renewal times. So some may renew mid year, some may renew at a random month in the year. But when those renew, that's when you'll see your premium increase because it's a private insurance product, right? I always say you worked your whole life. The first thing you do is turn to the benefit guide at renewal season and go, how much more am I going to pay for the same exact insurance, right?
Right.
That's what you get to do with Medicare.
Okay. But so those premiums, the premiums for your supplements are
Mm-hmm.
going to be based on whatever that plan's renewal is. So it's not
Correct.
necessarily going to coincide with open enrollment
Correct.
or with Part A and B, which happens basically on the change of the year, right?
Correct. Correct.
Okay.
Yes. And Part A and B, those numbers are normally announced by now, and hopefully they will be announced soon. But those change every year. So I'm sure everyone knows that they just got a cost of living increase, 2.8%, right?
Yes.
But then you also know there's a flip side to that. Your Medicare Part B premium is probably going to go up.
And
We're estimating it's going to go up to about 206.50 and 50 cents, because why not tack on 50
sure.
cents per month per person in the home. So think about that's what your Part B is going to be going up to. And then there's also going to be increases on the deductibles that I spoke about with original Medicare. We estimate the Part B deductible going up to 288.
And what are the current rates and deductibles
Mm-hmm.
for
Yes,
2025?
for 2025. So for Part B, everyone is paying starting 185. That's the baseline premium, and then the deductible is 257.
Okay. And the baseline premium, we don't want to get too far in the weeds,
Mm-hmm.
but can go up based on your income. Is that correct?
Yes. So what they do, they meaning Medicare and the federal government, they do a 2-year look back. So they don't take a cumulative of the 2 years. They look back 2 years. So for next year, they're looking at how you filed your taxes in 2024 and what that adjusted gross income line item 11 looks like. Yes, I've said it a million times. Line item 11, what that number is, and that's what they're going to base your Part B premium on.
Okay.
Yeah.
And I should note, at the time that we're recording this, the federal government is currently shut down,
Yes.
which is why we don't know what some of those numbers will be for next year. Luckily, the Social Security cost of living increase got announced,
That
but
is official.
we do not know
Yes.
in terms of the Part A and B premium and the deductibles
Correct.
yet. So
Correct. So I'm just speaking off of estimates.
sure.
I'm like Forbes.
Just making
Yeah, just
some
make,
educated guesses
yes,
on what's going on. So, anything else that you think it's important to talk about in sort of an overview of Medicare? Do we want to talk about the birthday rule? Is this a good time to talk about that?
It's kind of part of everything. It's not specific to this year or this open enrollment, but if you are a birthday rule state, which there's 11, 13, something like that. Kentucky is one of those states, and Ohio is on the chopping block to maybe be one of those states as well. While it's the way it works, I'll start there, is every year, the month of your birthday, so on your birthday, you have the opportunity to change your Medicare supplement plan to the exact same plan design of a different Medicare supplement insurance provider without going through medical underwriting. This is on your birthday, pretty much, and then 60 days following. 60 days, not 2 months, but 60
60
days,
calendar
right?
days.
60 calendar days, and they're very specific on that. So what happens is if I am on a supplement plan F or plan G, right? I'm going to say the most popular letters, not numbers. I have the opportunity to review my plan on my birthday and say, you know what, I'm paying X amount of dollars. I want to look at a plan G with another company and look at that premium. And if there's some significant savings, then I can move my Medicare supplement at that time. I don't recommend that this is something that you need to look at every single year because we're not in the business of moving around that frequently and there's not that much difference.
Sure.
But if you've been on a med sub for a very long time, it might be something to look at to help offset some expenses while still being able to stay on your Medicare supplement.
Okay. So I think that's a good kind of covers the overview of things. Let's talk about changes coming in 2026 because it seems like every year there's changes. I think 2024 to 2025 there were some pretty significant changes. Sounds like maybe more of the same 2025 to 2026. So what do we don't need our crystal ball. We know what it is. So what is happening?
Well, I call it job security. So what is happening? So we've got a couple things that are going to be showing their face in 2026. The first is, and I talked about it last year, is the Inflation Reduction Act is still creeping into these prescription drug plans, right? And that's on both sides. So you have your prescription drug standalone plan, and then you have your prescription drug plan embedded into your Advantage plans. What you're seeing is the first piece. This is the first year in 2026 where the first 10 drugs were negotiated by the federal government. This is the first time in history that the federal government has got involved with negotiating the retail cost of prescription drugs. And they tackled 10 expensive drugs. So you're talking your Eliquis, your Jardians, right? These are expensive medications with retail costs that are really high. And when prescription drug plans are charging individuals percentages for those versus a flat dollar copay, right? That can get very expensive for the user, right? So what they did was they came in and they started knocking off what you were actually allowed to charge as the retail cost, which in turn is bringing down the overall expenditure for both the user and the insurance company, which is a good thing, right? So if you're on those top 10 drugs that they started with this year, that's a good thing for you, right? Um, if you're not on one of those top 10, pay attention because this is going to keep hitting us year over year until 2029. They're going to keep negotiating between 10 and 15 drugs every single year, which is really great. Um, we are seeing this deductible. So there's always a deductible that the Centers for Medicare and Medicaid Services set every single year. Last year it was 590. This year it's gone up to 615. Okay, that is the maximum amount that an insurance company is allowed to tack on as their deductible on a plan. Doesn't mean they have to have it. It just means they can't exceed it. But what I'm seeing on some of the plans, and individuals can go look this up themselves, is that on the standalone drug plans and on Advantage plans, these deductibles are showing their faces. And
And that means that basically the first $615 worth of prescriptions,
mhm,
you're going to cover that full 615, right?
yes, and usually it's only applying if your medication falls in the tier 3 through 5, right? So that's expensive medications. But for those individuals that do take those medications, January is going to be hard. If you're filling medications in January, it may be tough for you.
Yeah.
Just prepare financially for that. And there's really kind of no loopholes in that
Okay.
realm.
No way to spread out that
I,
deductible or.
well, there is if you enroll in that premium payment plan that we talked about last year, where you can call your insurance company and ask them to basically balance bill you every single month for the cap, which last year the cap was $2,000, or this year, sorry, 2025. It's actually going up. It's already creeping up. It's going up to 2,100 for next year. Not a big jump, but that's the limit on what you'll spend out of pocket for your prescription drugs next year.
So they can balance bill that number.
Yes.
Okay.
Yes. So they can do that if January is too heavy for them, which for many it is.
Sure.
So that is happening. You're also seeing on the prescription drug side of the house plans leaving the market. They're kind of tightening up on that side. They're tacking on that deductible. Premiums are going up, and it's really equating to the entire model of the Inflation Reduction Act, where it's offsetting the cost of prescriptions to insurance companies. You have a for-profit company who's trying to make money. What are they going to do? They're going to either take more money in your premium and then they're going to tack on deductibles so that they get that money as quickly as possible. Right, that's what they're going to
Sure.
do, right? Or they're not, and they're going to lose out, and then they're going to go bankrupt,
Right.
and that's not going to happen. So that's what you're going to see on the prescription drug side of the house.
And I feel like, and of course, correct me if I'm wrong, but
Yeah.
prescriptions, this is where someone like you can really help because not all plans are equal in terms of the medications that they cover.
Yeah.
So it's really important to have someone that you can sit down with. And obviously, we can't predict the future, but and look at what medications you're on today and know how that prescription plan is going to work for your medications because the one you were on in 2025 may not make sense anymore financially for you in 2026.
Yes, 100%. That's why it's so important that if you're not one of those people that have looked at your plan every single year, you need to at least just do yourself a favor and inquire and make sure that you're still sitting in the right spot going into 2026.
Yeah, so when people sit down with you, they're going to bring their list of prescriptions, they're going to bring their list of concerns, and you
Yes.
are going to go back and forth and kind of help them identify
Yes.
where they're going to get the best bang for their buck, the best coverage, all the
Yeah.
kind of meet their
Yes.
goals.
Yes.
That's great.
Yes. And then the other piece with this, which I'm hearing a lot about my newer clients not understanding the difference here, and I want to share it because I know you have a wide audience here, is understanding the difference on your plan between a preferred and a standard pharmacy. It's very, very important when you're on a drug plan. Obviously, preferred is where you should be going to fill your medications. A standard is not preferred, right? So you're going to pay more potentially for your medications if you're at a standard pharmacy versus a preferred pharmacy. So knowing which preferred pharmacies are equating with your plan is imperative. Because when you're on those expensive medications, or even if you're not, and you go to fill your medications and it's $3 or it's $10 or it's $500, you could have saved money by going to that preferred pharmacy and you didn't even realize it.
So part of this equation is not only the prescriptions that you're on, but also, uh, you know,
Where?
if you want to go to CVS, if that's the place that's close to your house, is that a preferred with the plan that you're looking at? And if it's not, what are the trade-offs? If you go, yeah, wow, there's a
Right.
lot of factors that go
Yes.
into making that decision.
I know. I know. Job security. Told you.
Well, it really does reiterate the importance of having someone knowledgeable and ethical to guide you through this process because it's not. There's only so much that a pamphlet can tell you,
Yes.
and sorting through all of that information.
Yes. Yes. Exactly.
Yeah.
The other pieces that are happening that I think it's important to make note are some carriers are bringing back prior authorizations on the Medicare Advantage side of the house. not, this is not a blanket statement. This is basically just some are. And so just be mindful of, if your plan is, finding out what that entails, what that's going to mean for you and your care. If you have specialists, is that going to interrupt your care right now? You just want to be mindful, asking your physician, calling into your insurance company, talking with your agent, understanding what that looks like for you. And your agent should be advising you of these things if that is what your situation looks like. So be ready for that. That's a new thing that's coming out.
And that means that before you visit a specialist, that the insurance company would have to authorize the necessity of that visit,
Yes.
correct?
Yes.
Or have a certain procedure, same kind of thing?
Yes. Yes. They're really trying to make sure that there's a need, right? And I think we can all guess why.
Sure.
But that's what we're seeing show its face. And it used to be there, but it took it away for a while, and now it's kind of coming back a little bit.
I was just having that conversation on like just the employer side of things. Like, I remember the days where you used to have to get an authorization or get a referral, and now you can just call directly to the specialist on a lot of plans. And so that is a big change. It could be a big change for a lot of people.
There's big changes everywhere, right?
What else?
Yes, what else? Well, I talked about it last year, and I think we saw a glimmer of that really across the board. Was the grocery cards were going away, right? We're not getting food, and we're not able to pay pest control. That kind of thing is going bye-bye.
And that was something that was showing up previously on Advantage plans.
Correct. Correct. This is an Advantage plan piece. You are still seeing benefits for the over-the-counter that have been there for a while. You are entitled to some of those benefits that I just mentioned. If you have certain health conditions, a plan may offer some type of benefit for that. Or there's still those types of benefits for individuals that are Medicaid and Medicare eligible. So if you are what we call dual eligible, you still may have some of those pieces embedded into your plans.
Okay.
Yeah. So it's not everyone, but if you're just on a Medicare Advantage plan, you're not going to really see those types of benefits as much as you were before. Talked about supplements, talked about drug plans. That's really all I have. I think the biggest piece that I want to make sure people know is that you are your only advocate for your healthcare. And if you don't understand how your plan works or what you need to do to make sure you're getting the most out of your plan, then no one's going to do it for you. I always tell my clients that if something doesn't seem right, if something seems off, look at your billing statements, make sure everything is coming in like it should. Even if you're on a supplement, look at those things. Look at what you're being billed. Look at what's hitting the EOB. It's so important that you take a stance on your healthcare. It's never seemed that way your whole life, right? You just pay a bill, right? Or you call the hospital and pay it over the phone. But on Medicare, you really need to dissect what's happening. You're the only one that's going to do that. So yes, that's my big up on the mountain speech about.
Well, and I think that really starts again with sitting down with someone like you to start with the foundation of picking the right plan and then understanding it, right? And so once someone's worked with someone like you who fully understands these plans and can make that recommendation, now at least you can focus. Okay, now I just need to know my plan. I don't need to know the other plans. I just need to know, how is this going to work for the next year moving forward.
Yes.
That's great. This is my favorite part of talking with you. If someone wants to meet with you and go through all this, and you're going to go through their prescription list and you're going to help them pick the right prescription plan, you might save them some money or you might save them some headache. What do you charge for those meetings?
Oh, nothing.
Nothing. So they can set up a meeting with you. You're not going to charge them anything. You're going to go through their situation and you're going to help them pick the right Medicare plan.
Correct.
So that hopefully they are not, 6 months down the road going, oh my gosh, I'm spending way more than I thought I would, and confused about what bills are coming in and all that stuff.
Correct.
Yeah.
Correct.
Great.
Yes. And just because it's free doesn't mean that it's like cheap services. Okay.
No, I mean, we have referred many people to you, and they're always incredibly thankful for the work that you all do in sorting through this maze for them, because it is something that, I mean, look, I'm adjacent to the industry, right? Like I'm not helping people with their plans, and it's confusing to me. So having a partner like you is great, and one that we know will steer people to the right plan for their individual needs. So Lauren Trondal, Senior Benefits Simplified. We'll have all of their contact information with this video. How do people book an appointment with you?
They can call our office. They can go on the website and schedule a meeting, or they can shoot me a text or an email. It's pretty easy.
Perfect.
Yeah.
She makes it easy to get a hold of her.
Yeah.
Thanks for coming in today. I really appreciate it. Like I said, I think people get a lot of value from this interview every year because it is a confusing topic, and I think there's reassurance in knowing that there's someone out there who can help them.
Thank you. I love being here.